Okay, welcome to Anatomy 01. This is going to be our first lecture or class where we teach you all of the fundamentals that you will need in terms of anatomy going forward through your course. So today we're going to cover the anatomical position, planes of the body, location terms, and an introduction to the skeleton. So first of all, the anatomical position. What is it and why is it important? The anatomical position describes a reference position for the body. It's described as standing upright with the feet approximately shoulder width apart and the toes pointing forwards. The knees are soft, slightly bent. Arms are by the side with the palms facing forward. The head is up with the eyes looking forwards. So this is a very, very important position. Very, very basic but important for us because it's the reference position from which we describe all parts of the body in relation to each other and from which we describe movement. So it ensures that we have the exact same picture in our heads when we think about the body. So standing upright as opposed to sitting down or lying down on the ground. If I was trying to describe movement to you and I was thinking of someone who was sitting down and then they had to perform a movement versus you picturing someone who was standing up and they had to go and perform a movement, we'd have to start off by describing two different things because we're not thinking of the body in the same position. Likewise, if we want to describe where things are in relation to each other, in the anatomical position we have this fixed reference position where we can describe things in relation to each other. If we didn't use the anatomical position, say for argument's sake I was thinking of someone with my hands standing with their hands above their head like this for some reason, and I was trying to describe the position of the hands, I would say the hands are above the elbows. But if I have in the anatomical position with my hands back down by my side, my hands are now below my elbows. So simple things like that could be confused if we didn't have this reference position. So the reference position is known as the anatomical position, and it describes the body standing upright with the feet approximately shoulder width apart, toes pointing forward. The arms are by the side with the palms facing forward, the head is up and the eyes are looking forward. So anytime we describe the body in this module going forward, we are thinking of the body in the starting in the anatomical position. From the anatomical position, we can divide the body up into different segments, and these are called planes. We use planes to divide the body. So a plane is like what you see in the image there. Imagine a giant sheet of card that is dividing the body into different parts. There are three main planes that we use to describe the body. We've got the sagittal plane, which we see here. That divides the body into left and right sides. They don't have to be equal in size. If you want to divide the body into equal left and right sides, we describe the mid-sagittal plane. So the mid-sagittal plane divides the body into equal left and right sides. The sagittal plane just simply divides the body into left and right, and those parts don't have to be equal. So we could have a mid-sagittal plane which goes right through the middle of the body and divides you into left or right. Or we could move that sagittal plane to one side and it could pass through the shoulder, for example, or it could pass through the hip. So the plane can divide the body into left and right. They don't have to be equal. If it passes exactly through the midline of the body, it's referred to as the mid-sagittal plane, sometimes referred to as the median plane. The second plane that we have to divide the body is called the coronal or frontal plane. It's easier to probably understand with the frontal plane as its name. It divides the body into front and back. Specifically, they're known as anterior and posterior portions. Okay, this plane runs at a perpendicular or right angle to the sagittal plane. And as I said, there's two names. It's often called the coronal plane or the frontal plane. It divides the body into front anterior and back posterior portions. The third and final one is called the transverse or horizontal plane. This divides the body into upper and lower portions. They are known as superior and inferior. So upper is superior, lower is inferior. So the horizontal or transverse plane divides the body into upper, superior, or lower, inferior, and lower inferior parts. The plane runs parallel to the ground, hence the name horizontal, or runs like the horizon, horizontal plane. So they are the three main planes. The sagittal plane divides the body into left and right. The frontal plane divides the body into front and back, and the transverse plane divides the body into upper and lower. Moving on, okay, we've covered the anatomical position and planes that divide the body up. The next thing we want to cover at this basic level are anatomical terms that describe where body parts are in relation to one another. We've mentioned a couple of them already: superior and inferior, meaning upper and lower. Specifically, when we say superior, we mean something that's towards the head, and something that's inferior is towards the feet. You'll see with these anatomical terms, generally they come in pairs because well, that's how it works logically, that if we have something that is towards one part, we have to have something that's away from that part as well. So superior towards the head, inferior towards the feet. Anterior and posterior, we've mentioned those already as well. Anterior means something that is towards the front, and posterior means something that is towards the back. Two that you may not have come across before: medial and lateral. Medial means towards the midline of the body. Lateral is the opposite, it means away from the midline of the body. Proximal and distal. These are ones that we use specifically when we're talking about the arms and the legs, when we talk about your appendages. So when we're talking about your arms and legs, we can describe parts of the arms and legs that are proximal, nearer to the trunk of the body, or distal, further from the trunk of the body. Proximal means closer or nearer to the trunk, to the main part of the body. Distal means further away from the main part of the body. Superficial and deep. Superficial means something that is towards the surface of the body, and deep is something that is away from the surface of the body. It lies underneath other structures. Supine and prone. Supine means something that's face up. Prone is something that is face down. So here we have a summary of all those terms and some examples of body parts described simply in relation to one another. So superior, we said, means towards the head. The collarbone, that's the bone at the top of your chest here, collarbone is superior to your hip. Okay, your hip is down around at your waist, the big bone down at your waist, below your waist there. So the collarbone is towards the head relative to the hip. And then opposite to that, we have inferior, which means towards the feet. The hip is inferior to the collarbone. So they are both located on the trunk or on the main part of the body. So we use superior to describe something that is towards the head, and inferior to describe something that is towards the feet. Anterior and posterior, describing something that is to the front and something that is to the back. The breastbone, your sternum, that bone at the very front of your chest there, is anterior to the heart. So it lies in front or towards the front of the heart. And therefore the heart is posterior to the sternum. It lies behind the sternum. Medial and lateral. Medial, we said, means towards the midline. Lateral, we said means further away from the midline. So if we think about your body, your hands specifically, in that anatomical position. So when we said you're in the anatomical position, your palms are facing forward. So when we are in that position, our little finger is medial to our thumb. Our middle finger is towards the midline of the body, closer to the midline of the body compared to the thumb. Conversely, the thumb is lateral to the little finger. It's further from the midline of the body. It's away from the midline. Proximal and distal. We said these words are used to describe things mostly when we're talking about your arms and your legs. Proximal means something that is on your arms and your legs that's closer to the trunk or closer to the main part of your body. Distal is something that is further away from the main part of your body. So put simply, the knee is proximal to the foot. So the knee is part of your leg. It is closer to the main part of your body than your foot. So we would say the knee is proximal to the foot. And then opposite to that we have distal. The foot is distal to the knee. The foot is further from the main part of the body when compared to the knee. Superficial and deep. Superficial, we said, means towards the surface or on the surface. So the skin on your body is superficial to the muscle. It lies on top of the muscle. It is the surface of your body, so it is the closest to the surface. Opposite to that we have deep, so something that is away from the surface of the body. Muscle is deep to skin, so your muscle lies underneath your skin. Your organs are deep to your muscles, and they're also deep to your skin. When we get to talking about your muscles, we'll see that some muscles sit on top of others. So we have some superficial muscles and we have some deep muscles. Finally, there we have supine, meaning face up, and prone, meaning face down. Strictly speaking, in the anatomical position, the hands are supine, face up. If you turn them over so that your palms are facing backwards, we now say your hands are prone. Supine meaning face up, prone meaning face down. Bringing that to an exercise context, if we think of two simple exercises, a push-up and a sit-up. In a sit-up, you are lying face up, so we say you are lying in a supine position. And for a press-up, you are in a face-down position, so we say your body is in a prone position. So lots of terms there. Hopefully some of them will be a little bit familiar. Just remember, they all come in pairs, so when you're revising them, revise them in pairs, and try to just use them as often as you can to help to make them to help to get those terms to stick in your head. Okay, so we've done the anatomical position, we've done the planes, and we've just looked over the terms that describe where things are located in relation to each other. I want to finish up by talking about the skeleton and just giving an introduction to the skeleton. So, the skeleton is a hard framework of 206 bones, which primarily provides support and protection for your body. It has 5 main functions. So we said primarily support and protection. The skeleton is the framework for the body. It supports all your soft tissue and provides a point of attachment for the tendons of most of your muscles. So your muscles are attached to your skeleton, and they facilitate movement in the body. The skeleton also provides protection. The skeleton is there to protect many internal organs. So if we take a stop for a second, can you think of a bone in your body that is there to protect something? Okay, perhaps the first one that might pop into your head is your skull. Your skull is the big bone that makes up your head there, and that supports and protects your brain that lies inside it. Or perhaps you might have thought of your rib cage. Your rib cage again provides support and site of attachment for muscles, but it also protects the organs that are located inside it. Your ribs, your heart, lots of blood vessels that lie in underneath your rib cage. Moving on, your skeleton also provides assistance in movement. So we said together with the muscles, the bones also work to produce movement. So when we have a muscle, it is generally attached at 2 points. It is attached where it starts, and it is attached where it ends. And when the muscle contracts and shortens, it pulls and moves the bones that it is attached to, and creates movement. We'll look at that in more detail in a future lecture. The skeleton is also a site of mineral storage, so many minerals like calcium and phosphorus are stored in the bones, and also in the marrow, in the bone marrow, which is found in the inside of our bones, is the site where all our blood cells are produced. Okay, red bone marrow produces red blood cells, white blood cells, and platelets. So all the stuff that's floating around in your blood, all the cells that are floating around in your blood, are produced in your bone marrow, which is found inside your bones. This process of blood cell production is called hematopoiesis. Okay, we're going to talk about the skeleton in a little bit more detail now. I'm going to switch screens here, so I'm going to move over to my anatomy, so you guys should be able to see a skeleton on the screen there. And I'm going to move this screen over here and have him up there. Right, so you can see this skeleton on the screen now. We're going to use this guy to throughout this module to try and bring things to life. This is a brilliant 3D model of the human body, so we can look at the skeleton there and we can start to add in different components. So we can start to layer in all the muscles of the body and isolate those muscles and see what they do. So we'll be coming back to this guy a lot over the course of this module. Today we want to provide you with an introduction to the skeleton. And one of the first things that I want you to know is that there are different types of bone in the body. So we said there's 206 bones. In the next lecture, we're going to introduce you to some of the main bones in the body. We're not going to go through them all individually. But what I want you to know that the bones in the body, all 206 of them, can be grouped according to their structure. So, first of all, in the body we have got long bones. They're the bones that you think of if you were to draw a cartoon bone. This is what you're going to think of, a long bone in the body. So an example of a long bone is the bone in your thigh there, your femur. Okay, so if we look at that guy in a little bit more detail, we see this is that a long bone. Because it is long, it has different features at different ends, but these long bones are generally our body's levers. We find them mostly in the limbs. So if we go back to our main body there, we can see we've got a long bone here in the thigh. We've got another 2 long bones in the lower part of our leg, our tibia and our fibula. If we look up in our arm, we'll see a similar pattern. We've got a long bone in our upper arm, which is called our femur, and we've got 2 long bones in our forearm, our radius and our ulna. So these long bones are levers, and they are very, very important for movement in the body. If you think about a lot of the movement that we provide, like if you want to run, walk, lift, carry, do many movements, our long bones, our arms and legs are going to be involved in some way, shape or form. Okay, so if we have long bones, it shouldn't be a surprise that we also have short bones. So if we zoom in here and we see we're looking at the forearm and the hand here. So in the forearm we've got 2 nice long bones, our radius and our ulna. In our wrist we've got short bones. So if we zoom in here, we see the bones of our wrist, which are these ones here, and our hand are these other bones here. So the bones of the hand there are technically classified as long bones, again because of their shape. But in between the bones of our forearm and the bones of our hand, we've got this group of bones here that make up our wrist, and they're made up of short bones. Okay, these short bones are strong and compact, and they're usually grouped together in areas that don't require too much movement. So we've got short bones in the wrist that we're looking at here, and if we zoom down to the ankle, we'll see again a similar pattern. We've got the long bones of the leg, the tibia and the fibula. We've got the long bones of the foot here, and in between those sets of long bones we've got a group of short bones here which make up the bones of the ankle. So we've got, there we go, we've got the short bones here. We've got a number of them that make up our ankle. So long bones and short bones. Another type of bone that's found in the body is called a flat bone. And a flat bone, unsurprisingly, is flat in shape. They are protective bones with broad, flat surfaces, and they provide sites for muscle attachment. So examples include the shoulder bone, the scapula, and the sternum, the breastbone. So the sternum we've mentioned before when we were talking about the anatomical terms. Here we've got the breastbone, the bone at the front of your rib cage there, the sternum, and you can see it's a flat bone. It provides a big flat surface which protects the heart, which lies more or less underneath it here, and it's a site of attachment for lots of different muscles. If we turn around the back, we can see your shoulders, your shoulder blades. Okay, specifically your shoulder blades are known as your scapula, also a flat bone. Okay, so a large flat bone providing a site for loads of muscles that help move the arm and move the shoulder and support the shoulder are anchored onto your scapula here. So we've got long bones, we've got short bones, we've got flat bones. Now, one that you may not have heard of before, you will have heard of the example, but you may not have heard of the specific name before, is a sesamoid bone. A sesamoid bone is a bone that is formed within a tendon, and we've got two in the body. One is the kneecap. So if we look at the kneecap here, we see that the kneecap sits on top of the knee joint, where the femur, where the thigh bone, meets the tibia underneath. And if we were to layer in maybe just the connective tissue on top, eventually when we get to the surface of it, oh no, we're going to have to add the muscles in. The muscles, we'll see that there we go, that kneecap, your patella, so that's highlighted in green there. When we add in the muscles, sorry, that's the wrong button. When we add in the muscles, there we go, it's encased in a tendon. Okay, we'll cover specifically what tendons are in a later lecture. A tendon is where a muscle joins on to a bone. So the kneecap, you see, is located inside that tendon there. If I take that layer back out, there we have it. See it cut away. Add the tendons back in. That's where it's actually located, inside those tendons there. So that's called a sesamoid bone, formed within a tendon. Finally then, we said we've got 5 types of bone: long, short, flat, sesamoid, and then the last type of bone that we have, just get back to our plain old skeleton here, is called an irregular bone. And an irregular bone is simply a bone that does not fit into any of the categories that we've discussed previously. So there's plenty of examples in the body, but examples include the spine, the bones of your vertebrae. So if we just pick one of those vertebrae there and have a look at that, we see that it is very, very irregular in shape, that individual bone of your vertebrae. It is not long, it's not short, it is not a sesamoid bone, nor is it a flat bone. It's got different components of all of them if you were to try and isolate it out. So that's one individual vertebrae, and specifically that's an irregular bone, a bone that doesn't fit in to any of the other categories. Another example would be your jawbone, your mandible. So again, if we look at that, your jawbone is an irregular bone. It is not long, it is not short, it's not a sesamoid bone, and it is not a flat bone. It's an irregular bone. Okay, so the last little bit that I want to cover today is about the bone itself. So all of the bones in our body are made up of 2 types of bone tissue. We've got compact bone and we've got spongy bone. Compact bone is a honeycomb-like structure that's found on the outside, the superficial surface of most of the bones in your body. Okay, so the outside surface of most of these bones that we're talking about is made of compact bone. Then separate to that, we've got spongy bone. Spongy bone is more spongy in appearance, so it has fewer. If we think of the compact bone is like honeycomb, it's got many tiny holes that are knitted together. Really, the bone material is knitted together very tightly, making it compact. Spongy bone is more like a sponge in appearance. There's more gaps. There's bigger, larger holes that it, and it lies deep to your compact bone. So your compact bone is on the outer surface and your spongy bone is on the inner surface. Finally, then we want to talk about long bone structure. Okay, so this is a little bit advanced. If you've kept up with everything that we've covered so far, fantastic. If you're interested and you want to know more, here's a little bit of extra information about long bone structure. So when we look at a long bone in isolation like that, we've got a few different parts that we can identify on the bone. So first of all, the main shaft of the bone here, so the main part of the bone is called the diaphysis. That is the main long part of the bone. So if we look there at the body of the femur, what's highlighted in purple there, that would be known as the diaphysis. At either end of the bone, then we have what are called epiphyses. So we've got distal and proximal ends of the bone. So on this we're looking at the head of the femur. That is one of the ends, and down here we have another end of the bone. So if we highlight the two of those, we can't highlight the two of those. So we've got the different ends of the bone are known as the epiphysis. The middle part of the bone is the epiphysis, and either end we've got a proximal and a distal epiphysis. On our long bones, then we also have articular cartilage. So if we look at this end of the bone here, where the femur forms the knee joints. So we see when it's put back into position here, we're looking at the knee joint here. Where that joint is, at the end here we've got articular cartilage. So that's a thin layer of cartilage that covers the epiphysis, the end of the bone, at a joint. So this is at the knee joint. At the other end we've got the proximal epiphysis, which is at the hip joint, and we see that the top of the hip there is covered in cartilage as well. So it's either epiphysis is covered in a layer of cartilage where the joint is formed, and that's there specifically to reduce friction and wear and tear. The very outside of the bone, so the very outside of the compact bone, is called the periosteum. That's a tough sheath that covers the bone's surface. It contains bone-forming cells that allow the bone to grow in diameter or thickness, but not in length. So one thing it's important to remember is that when you train or when you exercise, yes, your muscles will get stronger and there'll be changes and adaptations in your muscles, there'll be changes and adaptations in your heart and your cardiorespiratory system, but over time there'll also be changes in your skeletal system. So your bones, if you do weight bearing activity, high intensity weight training, anything high intensity activity where you're supporting your own body weight or lifting weights, your bones will also respond by getting stronger, so they can become more dense. They can respond by getting a little bit thicker, but unfortunately they don't respond by getting longer, so we can't make ourselves taller like by that. Finally, the last thing I want to cover today is the inside of the bone. The inside of the bone is called the medullary cavity, and that's the space within the diaphysis, that's the long main shaft of the bone, where we find the bone marrow. So I think we might be able to look at a cross section here. So if I pick out cross section there, okay, so we're looking at a cross section of the thigh. So like that is we'll be looking at from the front, I think, and if we look down onto this cross section here, we see all the muscles that are laid out, and here we have the bone highlighted in green in the middle. It's going to unhighlight it there. So you see there the different coloration on the bone, on that cross section. We've got the compact bone around the outside, we've got the spongy bone more towards the middle, and in the very center we have the medullary cavity, and that's where your bone marrow is going to be found. So within those bones we've actually got a blood supply, so that there's holes in your bones that allow for blood vessels to go in and feed and nourish that bones, and also to take out the blood cells that are produced in the bone marrow and deliver them back out into the circulation. So that's a cross section. I'll zoom out a bit there. That's a cross section of the thigh, so we're just looking at a little section. If we look down into it, we can see the different muscles in this location, and the bone, and this also shows us the blood supply and stuff. But there we've got the outer layer of compact bone, the inner layer of spongy bone, and the very center is the medullary cavity where you will find the bone marrow. So all that stuff about long bone structure, that is the nice to know, fancy to know, or if you're interested, information. All the other stuff we have discussed about the anatomical position, the planes of motion, the terms that describe the body parts in relation to each other, and the types of bone in the body, that's need to know information. Okay, so the first 4 things that we covered, need to know. You should definitely revise them. If you're comfortable with all the stuff at the start and you want to study this in a little bit more detail, that long bone structure is nice to know information. Okay, that's the end of this first lecture. If you have any questions, you can catch me on Microsoft Teams and ask any questions there. Thanks for your attention.